Well, I think we will go ahead and get started with our housekeeping items. We want to welcome everybody out today to our press conference. If you are members of the media and you need permission to record, just drop it in the chat, and our team helping with some of the logistics will make sure that you have that ability. Just a few reminders for everyone. Please keep yourself on mute unless you are speaking. To help with ASL interpretation, please also keep your camera off unless you are speaking. And a reminder for everyone to speak slowly so that both our ASL and our Spanish interpreters can keep up with you. We will take questions in the chat. So if you have a question that comes up, please type it in the chat. If you're a member of the Spanish media, we have Spanish interpretation. So hopefully you've been able to get into that room. If not, make a little note in the chat and we'll help you get in there. And then at the end for Spanish media, you'll have a chance to ask your question in Spanish if you need that for recording purposes, and we'll translate into English for our speakers to answer. We will record this and send out a recording from the health department's email list. So if you need a copy of that, we will get that sent out this afternoon. This is being live streamed on Facebook and our other social media channels, so you can also access it there if needed. I'm going to just do a quick introduction of our speakers and who we have from the Utah Department of Health here today to help answer questions. We're going to hear from Nate Checketts, the Executive Director of the Utah Department of Health, Dr. Leisha Nolen, the State Epidemiologist at the Utah Department of Health. And then we have several staff from some of our teams that are largely impacted by this steady state phase that we are entering in the pandemic. Also have members here, Kendra Babbitts and Brittany Brown from our testing team are here. We have Cindy Wynette with our COVID-19 vaccination program. Abby Collingwood is with our data and surveillance team, and Chris Ann Bacon with our therapeutics team. I also want to recognize our interpreters here today and thank them for being willing to help us out and continue to provide information to our ASL and Spanish speaking communities. Clay Anderson with the Utah Department of Workforce Services. I think many of you are familiar with Clay and have seen him at past COVID briefings. Who you may not see very often are our Spanish interpreters. We have Israel Gonzalez and Alejandra Serrano with ComGap International Language Services with us today as well. So with that, just doing one last final check that we are ready to go with our Spanish interpretation room. And if so, I will turn the time over to Nate Checketts, Executive Director with the Utah Department of Health.
Good morning. Thank you for joining us in this discussion on steady state. We've had a couple different meetings where we've talked about this with you, and we're excited to come back and report where we are in this process and the next steps that we're taking. Governor Cox announced last month that we were making these moves, and it's been part of our process as we now have greater access to vaccines and boosters, and that we've had a high degree of infection in our community, that many individuals now have higher levels of immunity than they've had in the past. And that allows us to make some of these transitions towards more of a steady state. It also allows our staff and our resources to be dedicated to the broader health issues that our society continues to face and has faced even during this COVID crisis. So we're excited to be able to move forward as we've been ramping down over the last couple of weeks to bring some of our services to a different level. We'll talk here about what we think about where we're at regarding our steady state for these services, and then also recognize that we are also going to be ready and prepared in case there are things that come back related to COVID-19 or if there's increases, that we would be able to ramp back up those services. So a key part of what we want to do today as we have this time with you is walk through some of the things that we've done as we move to this steady state. The first thing I'll talk about is related to testing. Starting after March 31st, we will be the state-sponsored community testing. The free sites will be ending. Those include the MACO, Test Utah, also known as NOMI Health and Tor Health sites. Will be closing on this Thursday, and we won't be providing that testing after this Thursday. That also includes our travel testing lanes and the travel testing that has been provided both here in Salt Lake City at the Cannon Health Building and also at our St. George locations. As we move away from providing travel testing, travelers will need to find private providers to provide that testing. The travelers are responsible for figuring out as they travel to different destinations what is required from them. There are different test types and different countries, different locations have different requirements related to that. As we've looked around and surveyed the community to see what private options are available, we've generally seen that costs, depending on test type, have been ran from about $60 to about $250. We have listed on our website, coronavirus.utah.gov/travel, information related to travel testing, and also provided some examples there that we found, and as we've connected with certain providers that are offering travel testing. So we know that's a change in what's been going on, and that's something that we've been working hard this week to make sure that travelers understand that they will need to look for other options after this Thursday to be able to get that testing. In general, the testing for these types of tests will be moved into a private model where individuals will work with their healthcare systems or these private providers to get these types of tests. As the Department of Health, we will continue to retain test kits on hand for several purposes. Some we've mentioned a potential ramp back up that we will be retaining some resources for that. We will also retain some at-home test kits, again, to help with targeted communities, and always working during this period to make sure that testing resources are available to our vulnerable communities. And so we will be continuing some sites in those communities, and also a new self-collection model that we'll be developing over the next couple of months and rolling out as a way to help ensure that testing is still available in our vulnerable communities. Moving on to treatments, there has been a lot of change in this area over the last couple of months related to monoclonal antibodies and antiviral pills. One of the significant changes that has occurred in the last couple of weeks is that the funding from the federal government for some of these services has been discontinued. And so some of these services that had been provided for free in the past, now providers will now begin billing insurances for those types of services. We have closed our infusion site in Mill Creek that was operated by the Department of Health, where we were giving monoclonal antibody treatments. However, those treatments and the antiviral pills are still available in clinics, hospitals, and pharmacies across the state. We continue to encourage individuals with compromised immune system to look at the Evusheld product as a pre-exposure prophylactic that could help them avoid problems if they were to be exposed to COVID-19. And we also encourage individuals to go to their doctors, their websites, or the Federalist if they are seeking treatment from providers. In particular, related to the antivirals, and the most commonly known one of those, Paxlovid, that is widely available in our state through pharmacies, hospitals, clinics, urgent care, and other providers. We encourage you to go to coronavirus.utah.gov and look for the COVID treatment button to see where you can get providers. As I mentioned earlier, both in the treatment and in the testing area, we know that some of our communities still need additional help as they are looking to respond to the ongoing COVID situation. So as I mentioned, we will continue to have support options in those communities, including providing tests to community centers and other areas where we think we can buttress the efforts that are going on in the healthcare system and in the private provider system related to those communities. So with that overview, I will pass the discussion over to Dr. Nolen to cover some of the other areas where we are making changes related to steady state.
Thank you, Nate. Yeah, so I'm happy to present to all of you some information about how we will be sharing information about the pandemic and about how cases are being affected, what's happening here in Utah. But the main thing I want to get across to all of you is that even though how we present things is changing, we still have a really good ability to monitor things here in Utah at the Department of Health. So what you see might be a little different, but we are still able to see a lot of information and keep on top of the trends and know what is concerning and what is not here in Utah. So first, what's going to change from what you see? Well, one thing that will change is that our website will now only be updating weekly. It will be updated on Thursdays, and it will show data for the entire preceding week, but it will only get that once a week. And also on our website, we are moving things around to really emphasize things that are more long-term trends instead of focusing on cases. So instead of having cases and percent positivity at the very, very front of our website, we're going to emphasize things by putting them forward, such as syndromic surveillance and wastewater. And those are because we know those are the metrics we're able to follow most accurately now as we go to this steady state. Also, the media will be getting briefings only once a week, again on Thursdays, and that will be information that summarizes the data for the full week and will say daily counts, but it will only come out once a week. And then the other thing that I think is important for everybody to recognize is that we're moving over to using the CDC community level for our different areas of Utah. A Utah transmission index was introduced very early in the pandemic that used very specific metrics to say what the risk was for Utah communities. A lot of those metrics are no longer as useful as they were before. So we are retiring that index, and then instead we're switching over to the CDC community level. And we recommend businesses and people use that to determine what their risk is in their community and what precautions they need to use. So with those changes, I want to reassure everybody that we do have really good information and we continue to be able to monitor many things. There are a few things that are changing how we detect things. The main one is that we are changing how we look at deaths. As you know, Utah has had a really rigorous system to evaluate all the deaths due to COVID in Utah, to understand what is truly related to COVID and what is accidentally found in somebody who has COVID and died from other causes. And throughout the pandemic, we've had our Office of Medical Examiners look at all the deaths and determine which ones are truly related to COVID and which ones are an accidental relationship. Going forward, we're going to be switching over to using death certificates to really fully evaluate that. And this is useful because we know the Office of Medical Examiner has used a very large amount of time to do these evaluations. So going forward, we'll be able to use death certificates to determine who has died from COVID. Reassuringly, when we went back and looked at how many death certificates mismatched what the Office of Medical Examiner determined to be a COVID death, we found that there were only 73 mismatches throughout the entire pandemic. That represents less than 2% of all the COVID deaths. So we know that this system is really accurate, and we can go forward confident in that we continue to have accurate reporting of deaths due to COVID here in Utah. But other than that, our systems really are quite stable, and we will be able to go forward and monitor things. As I mentioned, we have syndromic surveillance. That's a system where we look at who goes to the emergency rooms and what they're diagnosed with. And we can see when people go for COVID and when they go for other illnesses. And we can track who's going in and how often, and see whether or not more people are going in and if we should be concerned because of that. Also, we have a great system here in Utah where we can look at wastewater, so the sewage water that comes out of all of our houses, and we can see whether or not there's COVID in that water. And we've been able to do that for over a year, and we have good data showing when it goes up, we know that cases are about to go up. And we can look at different parts of the state to see, is there a trend of more COVID in the wastewater or less? And based on that, we can understand what the risk is and what's happening in those communities. And then, of course, we can continue to look at what's happening in our hospitals by looking at cases that are hospitalized. And in addition, even though we won't have as good information about cases because so few people will be tested in these mass testing sites, and most people will be getting home tests, we still do have the ability to monitor cases that are detected in our hospital systems, in our clinics, in our pharmacies. And so we can use that information to understand what's happening in cases that go to get testing at these official sites. So I think overall, what do we need to do as we go forward? I think we all expect there will be additional waves. We will have new variants of COVID coming through, and our communities will need to be aware of that. So here at the Department of Health, we will continue to monitor those waves, whether or not they're occurring in other countries and what's happening here in Utah. And we'll be sure to communicate with everybody as we see anything that's concerning or that needs to be addressed. For now, we really just want to encourage people to do the best they can to protect themselves. And a really important part of that is to get a booster. We know, looking back during the Omicron wave, that people who are boosted, if we look at the people who are unvaccinated and compare them to the people who are boosted, the unvaccinated people were 7.3 times more likely to go to the hospital and 18.9, so really 19 times more likely to die of COVID than those people who are boosted. So we know that boosts were really, really important in protecting people and saving lives during the Omicron wave, and we expect that to be true going forward. So we really encourage people who haven't had the time to get boosters to go back and get those. And happily, yesterday, CDC and FDA opened up that option for some people to get a second boost. That's specifically people who are over 50 years of age or people who have immunocompromising conditions. And they recommend that people consider getting that second boost because we know those people have a little less immune response and their immune system forgets how to protect in a little bit quicker. So there's certain populations now who are recommended to consider getting a second boost. And we encourage people to consider that if they are in those age groups or with those health conditions. But I think we can all feel that we know what we need to do as future waves go on. We have the data systems in place. We have the knowledge of how to protect people, and we can use that information to ride through future waves with little impact in Utah. Thank you.
Thank you, Nate and Leisha. We're going to open it up for questions. There's a number in the chat. So this is just a reminder to our media partners that if you have a question, go ahead and put it in the chat and I will start working our way through them. We have two questions that are quite similar. I'm going to start with Haley's first. The question is there concern that the move away from free testing could lead to an access issue for lower income individuals or those without insurance who want to get tested? I think I'm going to have Nate take that question. So Nate, if you want to come off, or there you go. I can see you now. I'll mute myself and you can answer that one.
Yeah, great. Thank you for that question. I think we have a couple different venues and opportunities for low-income individuals and communities to continue to get testing, even in this steady state environment. One of them is that we have, throughout the pandemic, we have been supporting clinics and other services that operate in some of these communities with direct testing supplies, and we will continue to do that. We still have access to those resources, and we'll continue to provide those testing options. So those will be able to continue on as we work with those partners, and that's an important part of our response. Also, another development related to this is at-home tests have become more readily available. We were able to purchase a number of those tests over the last couple of months, and we will have a program, again, working with these community partners to be able to roll out at-home tests for some of these communities to make sure that cost is not a barrier for these individuals to be able to get at-home tests. At-home tests are widely available now in stores, but we want to be able to support these communities with additional tests that are coming from these testing resources. And lastly, we do still have some sites that we will be operating in targeted communities, and those will be transitioning to some self-collect kiosks that we'll be developing that would allow individuals in those communities that don't have other options to be able to still use those even in our steady state response.
Thanks, Nate. I'm going to go to Megan Messerly at Politico. Her question's quite similar. So Nate, you may want to answer this, or we also have Chrisanne Bacon. Chrisanne can help fill in any gaps too. The question is, you mentioned this a little bit with monoclonal antibody treatments, but how concerned are you about the fact that Congress is at a stalemate over new funding for COVID testing, vaccination, and treatment? And how is that impacting the transition to a steady state response? So Nate, I will let you have first dibs on answering that. And if we need to have Chrisanne come on camera and complete anything, we can do that.
Yeah, that sounds great. So related to that loss of funding, we have a couple of options that we're working with One is that many of those services are covered by insurance. So while in the past, some of those things may not have been billed to insurance, those that have insurance, those services will be able to be covered through their insurance. But you also highlight here, for many of those that don't have insurance, what options do they have? One of the things that we're reviewing right now is the possibility of expanding our Medicaid coverage for the uninsured. There was a special program that was opened early on related for testing. There is the ability to expand that for vaccination and treatment, and that's an option we're exploring to see if that's something that we could bring on quickly to be able to provide that services for uninsured individuals. And so that's one thing we're reviewing right now.
Thanks, Nate. We'll go to Paul Nelson's question. I think this is probably most appropriate for Dr. Nolen to start with. The question is what happened with the faulty rapid tests that were issued at the state testing site? So a gen body update.
Yeah, so we have pulled all those from testing sites. They were stopped being used as soon as we realized there was an error. We are working with both the FDA and the company to validate our results. And we are no longer using those in the state.
Thank you, Dr. Nolen. We'll have you take this one too from Lisa Riley Roach. The question is with the BA.2 subvariant now dominating US cases, how concerned are you about another surge coming soon? And what specifically would trigger the state to resume testing and treatment?
Yeah, so certainly we have been watching the BA.2 variant closely. As you know, it's hit Europe and Asia quite hard, and we certainly are now seeing increases in New York City and other parts of the United States. Interestingly, the BA.2 variant has been in Utah since middle of January. We sequenced our first BA.2 around the 15th of January, and we know that it's been here for quite a while. Yet, while it's taken over the small number of cases we had, it has not caused an increase in cases. So we certainly are watching this close. I do have some hope that we might have enough immunity still from the first wave of Omicron that BA.2 might not hit us hard here in Utah, but certainly it's something we need to keep track of. And in terms of testing and treatment, I think this is where we need to use the resources that we are setting up. We have clinical providers who can give tests. We have treatments available for clinical providers. I think all of us need to go into the mindset of we have home tests. If you have sickness, if you get some symptoms, you can do a home test. And if you have symptoms, even if you test negative, you should stay home because we know there's a lot of flu circulating and other infectious illnesses. So it's important to consider, we just don't want to spread whatever it is we have, no matter if it is COVID or something else. So I think we'll keep an eye on what's happening with BA.2, but for now, we aren't seeing that increase in Utah.
Thanks, Dr. Nolen. I wanted to add a small piece around the treatment side. So as many of you may have heard, the federal government has a test to treat program, and we are starting to see pharmacies in Utah become partners with that federal test to treat program. And there are 7 pharmacies in the state right now where an individual can go get tested, talk to a pharmacist and healthcare provider about COVID-19 treatments that may be best for them, and then get a prescription filled for antivirals right there in the same location. So that's another resource that is slowly starting to roll out for treatments, and we want to make sure that the public knows that treatments are still available. The best bet is to talk to your doctor, and if you have symptoms, to test quickly if you are at high risk and would benefit from those medications. We'll move on to our next question from ABC4 News. I think Cindy Wynette from our immunization program is on and is probably best to answer this question for you. So Cindy, if you want to get ready to turn your camera on. The question is when I went to get my booster, I was told hundreds of them were thrown away because they were no longer usable. Are you seeing vaccines wasted because the demand is low, and is this concerning? So Cindy, if you could speak a little bit to our vaccine waste and some of those issues that we have been working on.
Thank you, Jenny. And that's a really good question. In the last 30 days, we have seen about 1.5% uptick in our waste in Utah. Currently, we're at about 243,000 wasted doses of vaccine, mainly due to expiration. However, that's very low considering we've administered over 5 million doses of vaccine in the state of Utah. So that number is currently at about 7%. We still work with our providers as well to transfer and move around vaccine for those that don't believe they'll be able to utilize everything they may have on hand prior to their expiration date.
Thank you, Cindy. We have another question from Lisa, and I think Nate, this may be one that you want to answer first. Could you talk more about how the shift to for-profit testing will work with state vendors? Are there any controls over what can be charged for tests going forward by those vendors? And are more for-profit companies expected to begin offering testing in the state now?
Yeah, thank you. So as you noted, we have several companies that are working with us today through these state-sponsored programs that will now begin operating as private companies on their own. We've developed materials related to signs and those things to help individuals know that if they go to these sites going forward, that they are transitioning to for-profit sites and will no longer be engaged in the state program, and to make sure that that messaging is available for individuals so that they know that they're now approaching those companies in their for-profit activities, not as a state-sponsored activity. Prices for testing are set by the market that has operated through the COVID response. And so as individuals, as you would for other medical services or other diagnostic services, we would encourage you to check between multiple companies to find the one that's the best fit for an individual. And that may include the cost of those services provided, because they do vary from provider. Regarding the question about whether more for-profit companies would begin offering testing in the state, our testing numbers right now across the state are relatively low. I don't see this as being an environment where many new companies would step in, given that so many companies are already active in the testing, but we'll see how that develops here in the near future.
While we have you, Nate, we have a question from Ben Winslow. If you need to ramp up in the future, do you need to go through the legislature?
Yeah, thanks, Ben. Great question. We have funding that has already been appropriated to us for our response. And so within a certain level, we will be able to ramp back up. We've left contracts in place. We've worked really carefully over the last 6 weeks as we've moved away from operating, for example, testing sites, to leave those contracts in place so that if we do feel that ramping back up that process needs to occur, that we have access to that. We do have some funding available to do that. It would really depend on how large of the ramp up would need to occur. If we needed to return to a state of, say, what it was like in January of 2022 to that level of testing, that would be a significant increase over what we're doing right now and would likely require additional funding to do that.
And a follow-up to that from Ben, from a policy perspective, has the legislature blocked that? I think he's meaning the ability for us to ramp back up.
No, there's been no policy changes related to this move to steady state. This is an operational decision. And as we watch and monitor what is going on related to the COVID-19 pandemic, this is, as we're watching where the state is regarding vaccinations, boosters, and levels of previous infection, availability of resources, this move to steady state is really an operational response to that situation.
I think this is a nice segue to combine a couple of the questions we have left, and I'll let Nate, you answer first, and then Dr. Nolen, if you would like to make further comment on that. In general, how happy are we with where the state is at in its fight against COVID? And then kind of a follow-up to that, are we using any specific metrics to make those operational decisions about when we would need to ramp up certain efforts? So if there's any specificity around those metrics. So we'll let Nate answer, and then Dr. Nolen, if you would like to add anything to that.
Yeah, overall, I think there's many things that have gone right in our state in this response. And the pandemic overall is a terrible thing that has happened across the globe. And millions of individuals have died from COVID-19 and thousands of individuals in our state. Some of the things that have gone well for us in the middle of this terrible circumstance, we were able to ramp up our testing to very high levels from not having any COVID testing back in March of 2020 to be able to do millions of tests and be able to help diagnose individuals so that we knew who was infected and be able to take appropriate responses. We were able to roll out a very strong vaccination campaign to be able to take a product that had not been, individuals had never been vaccinated for COVID before, and being able to roll that out and be able to vaccinate a significant number of Utahns. Has everything been perfect? No. And where do we still need to go? Dr. Nolen highlighted earlier that we have vaccines, we have boosters. Boosters have been shown to reduce hospitalizations and death. And those, as she mentioned, there's even an option to do a new second booster for individuals that are 50 and older. We know that those, from all the data that we have, that those will reduce hospitalizations and death. Is our state sufficiently boosted right now? There's a lot of room to improve there, and especially with this opportunity to do a second booster, it's a great opportunity for individuals to get another shot and be able to help protect themselves if they are concerned about a future wave coming.
Thanks, Nate. Dr. Nolen, do you have anything to add to that?
No, I think Nate summarized it well. I will say, I think we are in a really good position. I think our state has good resources, has a good system, but I would reinforce that we have under 30% of our population boosted, and we know that's really important to protect. And I think we should expect future waves. And so I think that's the one weakness, is we need to encourage more people to get boosted and get more of those second shots in the arms.
Thanks, Dr. Nolen. This is the last call. If you have any final questions, please get them in the chat. Dr. Nolen, ABC4 just wants to confirm that you said 30% of Utahns were boosted. So maybe just clarify what the denominator is that you're referring to with that percentage.
Yes, I can. I should look up the exact number. I think it's about 28% of all Utahns have gotten a boost. And so it is looking at all Utahns, not just those who've been vaccinated. And that is important to recognize, but I think it's important to recognize those are the people who are protected. So it means less than 30% of our community has that extra level of protection that is going to be useful if we get another round.
Yep. And that metric is on our dashboard under the vaccines tab. So there's several ways that you can look at percentages of Utahns who are boosted by age. So it's important to get that context correct. Thank you for that clarification. Dr. Nolen, one final ask is, what are the triggers that we will be looking for? How will we know when it's time to ramp up?
Certainly. So ramping up is going to be something that we'll need to look at when we have severe disease. Certainly, we know there's going to be a future waves, and hopefully the protection based on our vaccines and by previous infections will keep us from having severe illness in this state. And so we'll need to keep an eye of how many people are getting severe disease, how many people are needing to go in for hospitals and healthcare. And keeping an eye on that and understanding what the trends are there. And if there is something that's overwhelming our healthcare system, if there isn't the protection we need, and that's where we'll need to consider whether or not we need to restart some of these additional protections.
Thank you. I had a question come offline to just verify Cindy Wynette's titles. Cindy is our program manager over our COVID-19 immunization program. And then, of course, Nate Checketts, Executive Director of the Utah Department of Health, and Dr. Leisha Nolen, State Epidemiologist with the Utah Department of Health. With that, I don't see any more questions in the chat. So we will conclude our press briefing. I want to give a chance for any of the media in the Spanish interpretation room to come over and ask your questions in Spanish, and our interpreters will be able to do that, help translate from Spanish to English if necessary. If you are not a member of the Spanish media and you want to hop off, please feel free to do so, but we want to honor that and give Spanish media a chance if they have questions in that other room. So we'll just take a few minutes for that if needed. Okay, it does look like we're going to have some questions from Telemundo, so we'll get one of our interpreters over into this room. Or if you want to ask them, Veronica, in English, that's fine too, but if you'd like them in Spanish for recording purposes, that's why we'll bring our interpreter over. Do we have Israel who can come over into this other room? There's Israel. I can't hear you though, Israel. If you just want to read Veronica's questions once your mics are working.
Can you guys hear me now?
Yep, you're good now.
Perfect. I'm gonna go ahead and interpret the question that was posed. So the question is, what would you say to those people who still do not feel safe? And in case of a new infections of COVID-19, would these protocols, would these safe protocols, will they come back?
I think we'll have Dr. Nolen answer that question.
Yeah, so I can understand why some people would still feel nervous about returning back to normal life. I can say for the vast majority of people, if they've had a vaccine and they've had a booster, it is reasonable to go back to doing activities, going out in the community. We know that the risk of hospitalization and death, if you've been vaccinated and you've had a booster shot, is exceptionally low. And so I think those people can go back and go into the community. I encourage them to take those shots so that they can have that secure feeling and can return to their life. There are a very small number of people who have severe immunodeficiencies that does get more of a risk. But now we do have treatments that can be given to those people, such as Evishield, which is a long-acting antibody that sort of supplements the body's own immune system. So there's options for all different kinds of people about what kind of protection they can have. And I do encourage them to seek out whatever protection is most appropriate for them. And I really hope people can get back to feeling secure and safe in their life. And then the second part of the question, can you repeat it for me? Sorry. Would the safety protocols return? So the question was, if there was a new variant or a new strain of COVID-19 coming through, would we return to safety protocols? And I certainly think that's something that would be very low on our list in terms of what we'd want to do. We'd certainly want to continue to encourage people to take the protections they feel is necessary to their personal safety. But I don't think we would prefer not to have to return to more stringent restrictions. But certainly if there's a very severe variant that comes that isn't protected by what we have in vaccines, we might have to consider that. I think it's very unlikely, but certainly we don't want to take it off the table if we have to.
Thank you, Dr. Nolen. Are there any other questions from our Spanish media partners? Perfect. Thanks, Veronica. Well, with that, we will conclude. There's several resources that our team has added to the chat that may be helpful for you in your stories. And as always, if you have follow-up questions that come later, please reach out to myself or the on-call PIO for the Utah Department of Health. Thank you so much.